Hey guys, so we have a very special guest over here. So let everyone know what's been going on.
I came in to see Dr. Suh for some right back pain, upper back pain, but we discussed how I have TMJ, I grind my teeth at night, and I also have a really painful bunion on my left foot, so I'm looking forward to being treated.
First thing we do is we're going to start with instrumentation, and we're going to look for any differences, in temperature, okay? Right there. And because of scoliosis, okay, we have to trace along the spine. Right there. Next component is static palpation, and what we're going to do is we're going to check for is there any presence of swelling or muscle tightness, and this is what I want to see. I want to see this nice smooth indentation, okay, and yet you see a lot of swelling all along this region right over here. This is all puffiness right over here, okay. I also see immediately right off the bat there's some swelling over here as well, okay, and quite a bit of swelling right in this region over here, which correlates what we find in heat differences. So now, next component is, we're going to do with motion palpation, we're going to see what's moving and what's not moving, okay? So, go check the sacrum. So over here, the right side moves pretty well. Feel that right there? On the left side? It's pretty stuck, right? So, now, let's check the left hip. Moves backwards, no problems. Moves forward, no problems. Move backwards on the right side, no problems. Forward and backwards, forwards, no problems, backwards, no problems. So we identified sacrum over here, that's problematic on her. Right there. To the right, no problems. Actually, correction. To the right, stuck. Left moves much more easier. Okay. So this looks like number 7 over here. Too low, to the left, much more easier. Stuck right there as well. In this X-ray structural analysis, as we can see, this particular patient has scoliosis. And the reason why is because over here, normal, her sacrum should be at this angle. And yet, as we can see, it's knocked backwards by a considerable amount. In addition to, on the forward picture over here, her sacrum should be in this normal position, and yet rotated significantly towards the right and sunk and tilted inferiorwards as such. As a result, all the structures above it compensated as such. In addition to, there's 2 more additional areas that did not compensate correctly. Therefore, her 3rd dorsal and the 7th dorsal, in addition to her sacrum, these are the 3 structures we need to correct on her. So as we see, easily tilt over to the left. See how much it tilts to the right? It's stuck right at that spot. Do you feel that one? Mm-hmm. Right. So, to the right. So I want you to turn to the left. Mm-hmm. Feel that? It's kind of stuck on the right at that particular spot. Okay. Check the atlas. See how much you could tilt your head to the left, how much you could tilt over to the right with this atlas. So that tells me there's a lot of compensation going on over here. Okay. Mm-hmm. So that's the reason why, most likely, we will not be correcting this over here. The reason why we're correcting the foundation first, okay? Just like in entire pizza, okay? If we don't do anything and address the foundation, everything from the ground upwards is affected as well. So let's see, even though you have some major scoliosis going on, let's see what it does for your neck. Okay. Okay. So we demonstrated earlier, okay, how much you could turn over to the left. Okay, let me slide that. Once again, over to the left. How do you like that? Feel that difference now? How much you can turn to the right? Now, tilt to the left. I don't know. You're still a little bit stuck on the right side. But do you feel that difference right there?
Yes.
You don't correct anything in the neck yet, right? So that's why we're talking about it. It's so important. Let's address all your foundation first and let your body unravel all the way straight to the top. Okay. So I want you to keep me appraised. Let me know in the following visits how you are with the bruxism, meaning
Okay.
grinding your teeth during the night, and your right TMJ.
Okay.
Okay.
I don't feel the shoulder pain. Really.
How do you like that?
It feels really good, actually. It's been hurting for a while now. It feels good.
Okay, so what's left over in terms of what's different on that right shoulder view?
It doesn't feel like a cracking.
Mm-hmm.
It feels good. Like relief.
So next thing what we're doing is we're checking the shoulder blade itself. Okay, check the scapula, see how it moves. So it's a little bit stuck over in this direction over here.
It's sore, yeah.
Mhm. So we're doing with a superior medial. Just pump it up a little bit. Okay, now let's check. Okay, how's it now? Is it still sore?
No, it's less sore.
In essence, what happened is these two bones over here, they start rotating outwards, and that's what's causing the bunion over here, is that significant rotation. Okay, so how do we address this? Well, that's going to be a lot more complicated thing to address because there's so many systematic things that failed on this foot over here. So we have to restore the nerve function all the way from the foundation. Take a look what's going on in the keystone, okay, the talus over here. Take a look at the navicular, the cuneiforms, first metatarsal, and even the great hallux. All the transverse and the lateral arches, all the structures, cuboids, everything. Basically what we have to do is pretty much rebuild the whole entire foot just to address this bunion over here. Now just relax. I'm just going to see. Okay, so you're more stuck, okay, on this left foot compared to the right. So he's a little stuck, calcaneus. You can't evert as well. Okay. See how much you could evert on the left one? That tells me the calcaneus on this one's fine. On this one is compromised. Okay. Okay, so this one over here, we could feel it, okay? I could evert your talus this way, but I cannot invert your talus on this side. So it tells me this talus over here is misaligned, so we need to correct this one as well. See, now your first metatarsal, I could rotate it going upwards. I cannot rotate it downwards. You feel that difference?
It's tight.
Exactly. So upwards, no problems. Downwards, not too bad. Okay. So now we have two little bones over here called sesamoids. Okay. It provides a fulcrum for the tendon over here. So now I'm going to check, feel where they are. Now normal, okay. These two little bones, you feel that little bony part I'm feeling? I'm pressing upon? Okay, it should be here. And yet, what I'm feeling right now is they're rotated significantly inwards over here. So we need to rotate them way quite a bit. And that's part of the reason this bunion is rotated the way it does. And that's what happens with the sesamoids, okay? Now let's check this one over here. Okay, this one's also rotated, it's just not as bad as this one. Okay, let's go ahead and check the cuboid. Feel the difference here? I can move it upwards. I can't move it downwards. Okay, so your cuboid, it's stuck upwards. Yeah, there's a little freebie there. See, we got the cuboid moving a little bit, but still, same story as well. Okay, I can move it upwards. Okay, can't move it downwards so much, so the cuboid's stuck up. Okay, so we got a lot of work to do over here. So first things first, let's go ahead, let's rebuild this. We're going to pump your talus. Relax. Right there. Okay, now we can see, okay, your foot, okay, it's able to evert a little more. I also want to reiterate once again, okay, we're still in the process of rebuilding your foundation, okay, because that's a very old chronic injury, okay, problem that's been misaligned for so long. It also blocked all that key critical nerve function to both of your feet over here. So even though we corrected this, okay, my expectation, this is not going to be stable, and it's going to have a lot of trouble holding in place. That's why we need to correct right at the source, rebuild and restore and stabilize your foundation, get proper nerve function into your feet over here, so these arches can stay stable a lot more better. Okay? So go ahead, walk around, see how you like it.
Feels good. It really doesn't hurt right now.
What other differences are you noticing with your feet?
It feels more flexible. Feels good.
So how do you like that, huh? Chiropractic. Isn't it a beautiful thing?